Hi, and welcome to Fireside Fridays. Woo! You're here with OCD Gamechangers. My name is Chrissy Hodges. I'm the founder and executive director here at OCD Gamechangers. We're a nonprofit that brings people together to create community, to inspire hope, to solve all the problems in the world that have to do with OCD. And that's one of our big topics today. Yay! And just excited that you were here today. Who am I? What do I do? I'm the founder of OCD Peers, which we just got new plaques. They're right there into my banana. Yay! It's a peer-based group practice. I do one-on-one peer support around the world, and I am the author of Pure OCD, The Invisible Side of Obsessive Compulsive Disorder. Oh my God, I'm like butchering this. Yes. So today I'm really excited about this topic, mainly because I really want to learn about this. I get tons of questions about it, and I think it's so confusing for everybody. And we have Dr. Molly Martinez here to talk about insurance. So Molly, please introduce yourself to our viewers.
Hi, thank you so much for having me, Chrissy. It's really an honor to be here. I really appreciate you asking me to join you to talk about how people can kind of leverage their insurance benefits to get the most care for their dollar. I'm a psychologist in private practice. I specialize in OCD. My practice is called Specialists in OCD and Anxiety Recovery, or SOAR. And I'm based out of Richardson, Texas, which is just north of Dallas. I am a transplant. I lived and did my graduate work in Ohio prior to this. And I've only been down here in Texas about 4 years, but we have a strong community of OCD specialists here that are working together, really trying to kind of create a network to help people that need the care and help them get the evidence-based treatment for OCD that they deserve.
Yeah, I'm always excited when I have clients that are in Texas and need a referral. I'm like, oh yeah, it's like the trifecta down there. Y'all got so many wonderful therapists.
Yeah, so we have a network called the DFW OCD Treatment Specialists. So there's about 30 of us, or DOTS. I'm into acronyms. But yeah, so we consult every month and refer to each other and try to help people get the care they need.
Speaking of acronyms, I had no idea that SOAR was the acronym for that.
Yeah, there you go. Already learning, Chrissy.
And also, I want to point out that Molly has the fire behind her.
Oh, yeah.
And she has a marshmallow.
Oh, yes. I'm into the fireside chats.
We really are into the theme, and rightfully so, because it is October and we're entering fall. Yay! Which brings me to some promos for all the amazing things we're doing. OCD Gamechangers hosts Fireside Fridays every other week. We do Maverick Mondays on the Monday following, so we will be live this Monday. And that's just one of our initiatives, some of the things that are coming up. As you know, October is OCD Awareness Week. The 11th to like the 17th, something like that. So we're doing really cool stuff. We just updated our website. We do have the therapist focus groups. It's our thought leader focus groups, but too bad if you didn't register, you missed it because we closed registration. So you better get on it next quarter, because this quarter is hot and spicy. I'm telling you, we've got tons of people. I sent out the doodle poll last night and I was just in awe of all the people that are going to be there. We're really going to start this off with a bang, trying to solve some of our big problems in our community with the people that know the answers, and we're going to collectively together figure those out. Along with that, we also just posted about the OCD monologues. Of course, that is after the mental health monologues and the vagina monologues of that. I didn't want to put that on the website because I didn't want to trigger people who have sexual orientation OCD. But it's an open mic forum. We are partnering with A Penny for Your Intrusive Thoughts, and we are taking submissions right now. So go to OCD Gamechangers under the events tab and click on there, and you can submit whatever you want for the open mic, which is spoken word, poetry, tell your lived experience, play some music, show some art. And then, of course, you can attend. It's virtual and it's $10 to attend. Second, I want to say that we are partnering also with the advocacy group hard work. And the week leading up to Halloween, we are going to do a campaign called hashtag Spook Yourself. And we are going to challenge you to post videos or photos of you doing things that might scare you to bring awareness to OCD and exposure response prevention. We're also going to bring in Sean Chinook. And I do this in every video, I feel like. And we're going to get some of his monster stuff and some swag, and it's going to be super cool. Also, all OCD Awareness Week, look for our TikToks. This is our young adults. We call them the OCD Gamechangers Z, the Zillennials. They do amazing TikToks. We're going to be doing 2 a day for OCD Awareness Week. So we got lots of stuff coming up. So excited to be here. That's my promo, so let's just get right to it. Today, we're going to talk about a hot topic, which is insurance. People always have all kinds of questions. Why don't OCD therapists take insurance? They're all about the money. They don't even care. Like, why can't I get treatment for this? Why am I not in network? What is going on? So Molly is here to really clear up some of that stuff, to talk to you about how you can you can advocate for yourself with the insurance companies and hopefully be able to clear up a lot of the questions that you might have in this process. So let's talk about, like, first question, how did you learn about all of this? Because it seems that not a lot of people have some knowledge about this, and you are really fluent in it. So tell us a little bit about how you got into knowing about this and sharing it.
Yeah, that's a really good question. The insurance companies clearly don't advertise this. I guess it maybe wouldn't benefit them. But Fred Pinzel, who's a psychologist, he has a blog, such a great informative blog. He's pretty much writes on anything and everything you can think of related to OCD in his blog. And he has one blog title that is Fight for Your Rights, OCD and Insurance. And he, in that, it was a very short article. I learned about this option that patients have to kind of coordinate with their insurance companies when they don't have somebody that's in network that offers ERP or that has any expertise in OCD. And so he goes through the process primarily in that blog about talking about single case agreements or letters of agreement in which the therapist can step into network for a single patient or single member of the insurance company. And that process is a little bit complicated and puts a lot of onus on the therapist. But this other option to sort of talk to insurance about their network deficiency or their network gap has proven to be something just through the last couple of years in my private practice I have realized is relatively easy for therapists to do. It doesn't really cost us anything other than sometimes a little bit of time, and sometimes not even that. And it really helps patients work directly with their insurance companies to get paid at a more fair rate, to get reimbursed really for the care that they're getting from the specialist.
Great. Well, I just posted Fred Pinzel, Fight for Your Rights. Go to his blog. I don't know his website, but if you just
Western
Google
Psychiatric. Yeah.
Okay. Well, just Google Fred Pinzel.
Yeah.
So I'm just going to go for the jugular here with the question that everybody wants to know. So let's just dive right into it. Why don't OCD therapists take insurance? What's their problem? Why do they hate us? What is it?
Such a good question, because if I'm on the market for a doctor or a therapist, I'm going to look in my network first, and I'm going to hope that they're there, because it's really expensive to pay out of pocket. I absolutely understand that. And I imagine it is frustrating for people with OCD. So several reasons. We'll start with kind of the obvious, which is that insurance companies just don't pay what the going rate is for specialists. So reimbursement rate. Okay, so not only do you have to, in order to be in network with an insurance, this is the way that they manage costs for their members is to basically kind of set a rate that they will pay for a service, and the therapists that are in network have to agree to be paid that rate. And a lot of times most of the time insurance base their rates that they pay based on the Center for Medicaid and Medicare Services, or CMS, which is the federal guideline for what Medicare and Medicaid reimburse for rates. And I actually looked this up right before the call. In 2001, the CMS rate for a 45-minute session with a psychologist was $102. Today, CMS reimbursement rate for a 45-minute session with a psychologist is $84.74. So that actually went down.
Why did it go down?
This is a decision that's made at the legislative level, and it kind of reflects the values that we have in our government and in our society about what a service with psychotherapy is worth. Wow. So adjusted for inflation, that's a 30% decrease. So if you think about just keeping up with inflation, that number should have increased.
Yes.
And when you factor inflation in with that, it's decreased. Now, that doesn't mean that every insurance company only pays $102, which anybody that's been paying a specialist out of their pocket knows that it's more than that. Mm-hmm. And the going rate for seeing a specialist is higher than just seeing a general therapist. So in the Dallas area, it's for a 50-minute session or 45-minute session, it's about a $170 to $180 for that same service. And it's more than just that. So most people, early in my career was in network with insurance. I was working at a group practice in Ohio, and everybody there was paneled with insurance. And it's where I started specializing in OCD, but I wasn't quite a specialist yet. And it's a way that new therapists starting out, the benefit to therapists is that they get a lot of their referrals from their insurance companies. So when you are new and nobody really knows you yet, you haven't established yourself, that's a great way to kind of get known in your community, get known by people that will then kind of say, hey, yeah, this person's great, go there. But after a while, and especially with an OCD specialty, referrals are like drinking from the fire hydrant. Like I get, more requests for new patient appointments than I can even respond to. I actually had to hire an administrative assistant recently just to respond to my emails and to help people get referrals and resources because, in the Dallas metro area, we've got about 7 million people and, a couple dozen true OCD specialists that are active at IOCDF, that are active at ADAA, and that are really working to do evidence-based treatment. So, there's a lot of demand for our services, and the basics of economy is that when there's a high demand and low supply, your rates go up. We've also been practicing longer and investing more in our specialty. And just investing in our careers at large. So that's one piece of it. So the supply and demand issue, the Medicare, Medicaid reimbursement rates that, usually insurance companies don't follow them exactly, but they base their reimbursement based on that. And then also just the restraints that insurance wants to put on care. So, for example, they might limit how long you can see a patient, how much time you can spend face-to-face. Well, ERP sessions, do take more time. And in the process that we'll talk about, getting that network deficiency status with your insurance to work with a specialist, one of the things you need to think about is what specific codes is that therapist going to use? And usually it's the extended service code, which covers up to an hour versus just the 45 minutes. Right. Because ERP takes more time. You kind of catch up on where the patient's been in the last week, plan the ERP, do the ERP, process the ERP. It's more than what you usually can do in 45 minutes. Sometimes if you're doing prolonged exposure or you want to just do more intensive work, I've spent a couple hours, up to 3 or 4 hours with a patient, really getting some, digging deep into some of their exposures. I also, before COVID, would do a lot of home visits. I've always, I think a lot of OCD therapists, a lot of OCD specialists kind of were ahead of the game when COVID hit, because teletherapy is so vital to our work. It allows us to sort of go into the home where OCD lives and do exposure and save a lot of money. But for some people that aren't comfortable with that, or that just need that extra support, or for whatever reason want you to come into their home, that travel time costs money, that going into their home and the time you're there, and insurance won't reimburse travel time, for example. Right. And then sometimes they don't want you to charge the patient for that additional service, even if you're in network. They might, have stipulations where you have to do excessive paperwork or reporting to justify the care that you're giving, which is additional time that you can't charge when you're in network with an insurance company, because you're only allowed to charge for that face-to-face time. So any of the planning that we do outside of sessions, any of the additional paperwork that's necessary is not covered. And then there, just additional liabilities and some additional requirements from HIPAA and other law, even if you just take a reimbursement from insurance. Even if it's one insurance company, the law applies to your entire practice, the additional things. And there are some insurance companies that, as I kind of referred to earlier, look for ways to sort of not pay you. Examples of this, sadly, TRICARE, the insurance that covers military men and women, is one of the hardest, because if you don't cross your T and dot your I, if you don't make that phone call, like they might say you're approved to do 6 sessions with this patient. And it's really up to the therapist, because when you're in network with somebody, the contract is between the therapist and the insurance company. Mm-hmm. So if you don't fax in a request for additional services and you have session number 7 with that patient, you don't get paid for session number 7. You just, or if you did something, you coded something wrong, or did something, which we will do, because these are labyrinthine systems, and we're human. You just don't get paid, and that's just not acceptable, given the the work that you have to do.
Of course. Well, so Dave, actually, hi Dave, and hey everybody that's here, yay! Dave asked a question which is interesting, that I was just writing this down, like when we started to talk about this. So without getting into like the in-depth talk about insurance panels and how those work, because I know we could talk about that for like another hour, and I want to make sure that we're hitting all these really important questions. So, unfortunately, on a lot of insurance panels, it will say, oh, we have our OCD people and they do EMDR, or they do, hypnotherapy or whatever. So what do we do? What is it going to take for insurance companies to really see that the only people that should be on those panels are the ones that are doing ERP? Is that how we change the game, or what's the relation there?
That's a really good question. And one of the important things to remember is that, one of your rights is to get effective treatment. This is a right that you have under the laws, to get effective treatment. Now, I don't know if insurance companies will ever decide that ERP is the only effective treatment. I don't know that is actually going to be something. We certainly can educate insurance companies. There's a lot of great work out there that demonstrates the cost effectiveness of CBT. That's really I think the biggest thing to get insurance companies. They are about the bottom line. Right? It's about how much money will they be spending on this. So I think to the extent that you can leverage from that direction, convincing them or demonstrating to them through research that it's more cost effective. Yes, it might be more expensive up front, but if you get your treatment and you get to a place where you don't need weekly therapy anymore in less time, it's ultimately less expensive for the insurance company. I know Eric Storch and some colleagues did a study about that recently, related to intensive care and intensive outpatient services for OCD being maybe the best, most cost effective. A lot of people don't want to consider that because it's so intense, and a lot of insurance companies might balk at covering that, but it's actually, you get to your life quicker, you get free of the impairment quicker, and it's a big investment up front for the insurance companies, but you get people functioning in their lives more quickly. I think that another big thing, another direction to approach this problem is from the level of the therapists. The insurance companies will believe what the therapist tells you they can treat. And a lot of therapists go in these, and they're like, they're already paneled with insurance because they want a lot of patients and they're looking for referrals and they need more patients. So they're going to say, I can treat everything. Like their incentive is to say, I can treat anybody that comes to me, I've got it. And some people really do believe that the treatments that they provide are effective for OCD. And maybe for some people they are. But our research does show us that the highest rate of response comes from exposure and response prevention for OCD. That's really your first treatment of choice. And so the third direction to approach this is just from the patient, being the advocate for your care. Yes, if you go to your insurance and say, I want to see an OCD specialist, they are going to pull out this long list of all of the therapists that have said, no, we can treat OCD. And you have to go through that list and research each one of them and say, actually, no, this person wants to do, psychodynamic therapy. This person is doing attachment therapy. This person has no experience with ERP. When I called them, they didn't even know what I was talking about. And so you have to be the advocate for yourself and for your care. You have to know what effective care is for the condition that you have. And you have to make that argument and make that claim to the insurance company.
Well, so then that brings me to my next question, which is, okay, so someone finds you, or someone finds, Justin Hughes, or, other people in the Texas area. I know, yay! Jeremy Rudd, like all the people in the Texas area that treat OCD, and they're like, oh my gosh, I finally found a therapist. They do ERP. I'm so excited. And then, it's like, they don't take my insurance. So that person is stuck with the, well, what do I do now? Or I can't afford this or whatever. What are their options? And because I think what happens is it's like this big brick wall comes up and they're like, well, now I can't do therapy. It's over for me. I can't do this, but what are their options? What do people need to know to advocate for themselves, to be able to challenge the insurance companies? Because as you said, it's their right to get effective treatment.
Yes. So the vast majority of people with OCD will have already been through therapy before. So they have already tried this with the person that popped up on their insurance provider's list. Right. And they will have done that maybe multiple times for multiple years. And that's the point in which they try to find, okay, I want the specialist. And then they're going to probably then find, the specialist is not in network with my insurance. There are some specialists that do maintain one or two insurance panels, but most of us are out of network with insurance. And these are the magic words that I want everybody say with me now. I've said it already before, but network deficiency. Network
deficiency.
Yes,
I said it. Y'all say it. Say it. Network deficiency.
Right. This is what you need to demonstrate to your insurance company, that their network has a deficiency. They are obligated to provide you effective treatment for the condition that you have. So if you have diabetes and there was no endocrinologist in network with your insurance company, there you go. I like it.
I spelled it wrong.
I think you got it. But yeah, if they had no endocrinologist, you would be entitled to see an endocrinologist and have some reimbursement from your insurance to see that specialist for your disorder. Same with cancer. No oncologist in network in your general area. Then you should be able to find an oncologist that is able to see you, and your insurance should be reimbursing you for what they would reimburse an in-network specialist. So what I just said is kind of complicated, and it doesn't mean that they're going to pay you back everything you paid to see the specialist, okay? Because insurance companies do set their rates, and they're not obligated to pay you more than what their in-network rates are. And as we talked about earlier, oftentimes specialists, their rates are higher than in-network rates. Now,
can I summarize to see if I'm getting it? So
yeah, please do.
Okay, so if there's a network deficiency, you can plead to your insurance company, look, I have this disorder, I need the specialized care, and there's a network deficiency. So I have found Molly Martinez, and she does OCD therapy. It's exposure response prevention. It's the only thing near me or whatever. And if that insurance company goes, okay, your rate, which, you stated earlier in Dallas, it's around 170, 180 in general for OCD therapists. Mm-hmm. Yeah. So, but if that insurance company is only, like stated before, $84, they may reimburse you per session for $84.
That's right.
But at least that's something. So if you can get this to work, if there's a network deficiency, at least you can get that much back for each session.
Yeah. And I would say private insurance. Yes, exactly. You got it. I would say private insurance generally pays more than $84. I think I've seen occasionally, I'll see some statements that come through from insurance companies from my patients that have done this, and I've seen like $120 pretty regularly reimbursed. And so I've actually even seen my full rate covered. So it's not completely out of the realm of possibilities that they wouldn't cover the full rate, but they at least would be obligated to cover whatever their in-network rate is. And they often won't tell you what that is, because the reality is it actually changes on almost a daily basis.
Why?
I honestly, I don't know. But I think there's so many factors that go into that algorithm for how they reimburse, that, yeah, I'm not really sure.
That's really scary and sad.
Yeah. I think like with any given provider, I think annually you agree to the rate. So it's not like it would change with one provider, but if if you come in on Tuesday and, if the rate is this rate, a different therapist that signed up on Thursday might get a different contracted rate. So it's variable, and a lot of this depends on self-advocacy. So part of how you determine sometimes that network deficiency is doing what I just said, and that is like going through the list of providers they say would treat OCD, because they're inevitably going to say, oh, no, look, there's 50 providers that within 3 miles of you that say they treat OCD, and
okay,
but the language. So ERP is recognized as being an evidence-based treatment for OCD, and that is in the language of the law or the code of insurances somewhere. So when they look that up, ERP is already recognized as the standard of care. It's also the standard of care if you look at the American Psychiatric Associations. If you go online, it will say this is the best care. So if your insurance gives you any kind of resistance with that, you can go and you say, no, look, the American Psychological Association, the American Psychiatric Association, they're in agreement. ERP is the way to go.
Okay.
And so, but you might have to go through that whole list and say, this person's not a specialist. This person doesn't, not an ERP person. This person hasn't had a CEU and ERP in 10 years. This person only sees 1% of their caseload has OCD.
So those are important questions to those are important things to look for. So what in CEUs, if you're listening and you don't know what that is continuing education units or credits. So asking that therapist, hey, I'm inquiring about what's your percentage of caseload that you do treat OCD. I always tell people to ask for success stories.
Mm-hmm.
Do you have kind of an average of what you should look for a percentage of your caseload that you would rely on?
Yeah, I would say the higher the better.
Mhm.
I'm probably 90 to 100% at a given time OCD, like almost only see OCD. Um, but at least 50% if you're
Mhm.
claiming to be a specialist, I would say at least half your caseload is probably going to have um, OCD, because it's just once if you're a specialist and you're established and you have referral sources, you're going to have so many referrals for OCD that if that's really your passion, like it is mine, like you're not going to see much else.
Right, right.
And also, Chrissy, I have two tabs in my website.
Okay.
Sorttogether.net. One is /insurance, and the other is I'm not sure what the / is, but it's how to find an OCD
Great.
specialist. So
Great.
all these things are on there. So just asking, do you identify as a specialist? Um, what makes you a specialist? Have you done a BTI with the International OCD Foundation? That's their training program for the International OCD Foundation. Have you, do you do those continuing education credits that every therapist is required to do every year? Are you learning about the cutting edge treatment for OCD every year? How many patients are on your caseload with OCD, or how long have you been doing this? Yeah, I love that about success stories. That's a really great one too.
Yeah.
But they're, really finding out, like, are you associated with the International OCD Foundation or another professional organization that addresses evidence-based treatment for OCD? And then there's some other, I trained in child and adolescent clinical psychology. So I now see both children, adolescents, and adults all. But if you have a child that you're trying to find care for, making sure that person also treats children is also something that, make sure they're in your age group, make sure they're in your area. That's another right that you have, is to see somebody, within a certain geographic area. It shouldn't have to be traveling a long way to find somebody. That can be another way that you can get that network deficiency.
That's great. So go to Molly's website, look up her sorttogether.net, and then she's got some tabs on insurance and finding a specialist. This is great information. I'm going to refer people to this actually on my own referral network. So thank you. A couple more questions. I wanted to definitely get your input of, we've been talking a lot about individuals with OCD. What is it that you think that therapists need to know when it comes to insurance? And I don't even really know what question to ask. So I'm just going to kind of give it to you of like, what do you want their takeaway to be from today?
So I think most specialists have been through the ringer with insurance already. And that's also part of why they're not on them anymore. They realize, like, this was a lot of extra time and work, and I don't want to touch that again with the 10-foot pole. So I mentioned single case agreements or letters of agreement before. And
Yes.
A lot of times when you approach a therapist and say, hey, I really would like to try to get some coverage from my insurance, therapists might be like, I don't talk to insurance. I don't do that. Like, that's not my gig. And it's not my favorite part of my job, honestly, but I do spend a considerable amount of time on the phone with insurance companies, because a lot of times the insurance companies will want to talk to the therapist directly. And oftentimes we have to talk to a psychologist that works for the insurance company. So there has to be this, like, professional to professional conversation. But it's the most frustrating part of it is honestly getting through the phone tree to get the right person on the phone, which often takes 20 minutes. And then I spent up to an hour, in these conversations. So because of not being able to charge for my out of face-to-face time, I do charge for those calls. And it's like a lawyer would do the same thing. And if your therapist immediately says, no, I'm not going to do that, I don't work with insurance, you can kind of explain that this is actually an agreement that I'm making with my insurance company, and I just need them to talk to you so that they know what you're doing and will agree to this agreement, between the patient and the insurance company. As long as the therapist, is reassured that I'm not going to somehow sneak into, the shackles of the insurance company in terms of them telling me what I can and can't do to treat my patient, and whether they will or won't pay me. And you offer to say, like, I'll pay your hourly rate if it takes an hour for you to talk to them. There are some insurance companies that are more they're easier to work with than others. So in Texas, I after doing this a number of different times, I must be somewhere on their list, because I did have to initially, like with Blue Cross Blue Shield, talk an hour to explain the process and what I do, and what my codes are, and what ERP is. But then lately, I don't even get a phone call anymore. I think they have my name, and
Good.
they get my patients get reimbursed that do this. Not everybody goes through the process, and you're not going to get reimbursed unless you go through this yourself to make these conversations talk. The step-by-step process is on my website. And I think the number one thing, the first thing I talk about is just having a good attitude when you go in, being nice to the people on the phone. It's going to be frustrating. It's not the people that you're talking to. It's not their fault. They're just trying to do their job. And they think oftentimes they'll think they have the answer when they don't really know what they don't know. So just being kind and being patient, and, continuing to appeal to that next level, getting a case manager or a care advocate is what they call them sometimes on the phone, that really knows, how to handle these cases and how to help you navigate. But, being calm, being collected, and being friendly. You trap more flies with honey than vinegar, as I say in the South.
So Southern. Yes.
So, know what your rights are. Don't be deterred. And I think just, know the process. You will probably know the process and know your rights and know what's available to you more than the first several people you talk to. And then you'll finally get to the right place. But yeah, for therapists, it's really not that difficult. You can still get your hourly rate for that time you spend talking, and you're not in the loop at all anymore. The check goes directly to the patient. It doesn't come to me. Occasionally it'll come to me on accident, because again, these insurance companies don't really know what they're doing with this process, but I just send it back. I never cash it. I send it back and have them rewrite it for the patient.
So just to, before we wrap up with kind of some final thoughts, I just want to recap to make sure I understand, in case people are watching and they're like, wait, what was that? So it's, the message to therapists is, after the person has advocated for themselves with their insurance company and said things like, there's a network deficiency. I need to, I live here. I need a specialist. I need this, yada, yada, yada. They may come to the therapist and say, my insurance company is asking that you talk to them. And the therapist may be like, no, I'm not talking to insurance companies. No, I don't do that. And then you can say to the therapist, they really just need to make sure that you're doing ERP or what your process is. I will pay you for your time. If you spend an hour with them, yada, yada, yada. And then at that point, that's all the therapist involved. So it's mainly just the advocating by the patient, which is what we really want to empower people to do in taking care of their mental health with insurance. Am I right?
That's 100% right. And it breaks my heart, because I've had people tell me, like, I told my therapist and they just refused. They would never talk to the insurance company. So I get where that's coming from a position of therapist, because I don't think a lot of therapists know that this is an option either, a really hassle-free option from their perspective. But but offer to pay them their hourly rate and send them to me if you need like somebody on this side to say, no, really, it really isn't a trick. But yeah,
right.
Yeah.
And at the end of the day, like that hour conversation may actually benefit so much, to the person that's receiving the care, and you might not have to see them as long and all that.
Exactly.
So.
And it's not just the reimbursement rate that is affected, it's also the deductibles and the annual maximum. So most of you, when we look at our insurance, our deductible is a lot higher and our annual maximum is a lot higher for the out-of-network benefits. So it's not only you're getting reimbursed for each session, you're going to meet your annual maximum and you're going to meet your deductible for that in-network benefit a lot faster. So it's more than just that per session fee that it benefits the patient.
Awesome. Excellent. I think I get it now. We're going to wrap up now, but what are your final thoughts? And thank you for being here, by the way, but what are kind of your final thoughts and inspiration for people that are listening that are like, I don't, I feel better about this, or I don't know about this, or whatever. Tell us what you think.
Yeah. Well, can I answer a couple of Dave's questions real quick? I just saw them pop up.
Mm-hmm. Yeah.
But, just really quickly, Medicaid, actually have had multiple patients with Medicaid, and they actually were one of the easiest insurance plans to work with and reimburse, in some cases, my full fee. So don't worry about, again, providers not taking Medicaid. You can still do this with Medicaid and Medicare. And yes, OCD is in the Federal Parity Act. And yeah, there should be no limits to the number of sessions that you get lifetime. And I'm not sure if that question popped up when I was referring to TRICARE. Like, it's just their general rule that they'll continue to approve more, but they want you to approve them every 6 sessions, which when you're running a caseload of a couple dozen people, it's hard to keep all of that in mind. But yeah, I mean, just know your rights. Tell people about it. Don't be afraid of insurance companies and of people telling you no. Know what you know and move forward with it. And this is something that nobody's going to hand you, but that you have a right to. And so educate yourselves, educate other people. Therapists, if you don't really specialize in OCD, by doing ERP, stop checking that box with the insurance company. And hopefully there will come a day when everybody knows what ERP is. Sort of like, hey, no duh. That's of course what you want for OCD.
No duh. I love that phrase.
I'm bringing it back from the 80s.
You are bringing it back. Gag me with a spoon. I don't know why I love that phrase. I just do. Molly, thank you so much. I think this is going to be so helpful for people. This is such an important topic. It's one of those things that it's just looming over here, and it seems so complex. And I think we really broke down some of the questions that people struggle with and don't want to look up because it seems so complicated. So thank you, and thank you for all that you do. I'm so glad you're part of our community.
Thank you so much, Chrissy. I'm looking forward to being part of your think tanks, and thank you for everything that you do.
Yeah, thank you. I appreciate that. And for everybody here, I hope that this was really beneficial. Visit Molly's website to learn a little bit more about this entire process at soartogether.net. Thank you for supporting Game Changers on our Fireside Fridays. I will see you Monday. We're going to have Ben Ruvo. I always get his name wrong, but I'll get it correct on Monday. We're going to talk about OCD, mental health in general, and athletes, which is such an important topic. And I'm super excited for you to meet him because he is badass. So other than that, have a great weekend. Go to OCDGameChangers.com to find out about all the cool stuff that we're doing. And I look forward to seeing you on Monday. Thank you, everyone. Bye.